Hello everybody. This is Ralph Terrazas, Fire Chief of the Los Angeles City Fire Department, and we thought it was time for another COVID-19 update. A lot's been going on. The good news is that the impact hasn't been as great as was originally anticipated. It's still a tragedy with thousands of people getting sick and hundreds of people so far dying in Los Angeles County. Your Los Angeles City Fire Department has been active on many fronts, and what I want to do today in the next few minutes is give you an update as to what's happening. First of all, let's talk about staffing. Our staffing is very strong. Last week we graduated a class of 49 new firefighters, and they reported to their fire station assignments last Sunday. Also, a few days ago I was able to make phone calls for 47 members of our department who were promoted. Their promotions will be effective on Sunday, April 26th. So our staffing is very strong, and we're ready for anything that may come and challenge us in the future. In terms of incidents, our call loads are down on average about 10%. Every 24 hours we run about 1,368 calls on average. So we're trending about 10% each day below our normal. In terms of transports, we're down about 35 to 40%. Each day we transport on average 591 times. We take people to the hospital that many times. In terms of members who have tested positive for the coronavirus, we have had 19 members test positive, and 8 of those members have returned to full duty. In terms of public coronavirus testing, we are supporting the 8 sites that are in operation within our city, and we have 2 sites where our firefighters, inspectors are the primary source of staff. Those 2 sites are at our training center next to Dodger Stadium, Hodgkins Training Center, as well as down in 57th First Inn, the Crenshaw Christian Center. We are launching next week an effort to test people experiencing homeless within Skid Row. That will be a new element of our response and our effort to protect the public. Nobody's doing that yet, but I do think it's a critical need, and we're ready to go next Monday. We are also supporting the effort at the Convention Center, the Medical Reserve or Relief Center. In case the hospitals reach their capacity, that will allow the hospitals to discharge people from the hospital to the Convention Center, opening up hospital beds. That's important to us because when we bring a patient to the hospital, if there's no beds available, we have to wait. And then our ambulance and our paramedics are taken out of service until the bed becomes available. So we've been involved with the planning for that because there's a direct impact on our availability to respond to 911 calls if there is no beds available. The other thing that I'm getting a lot of questions about is the coronavirus testing for our members, the antibody testing. The intent here is to identify people that are working for the department, firefighters, who may have already had the coronavirus and built up some immunity to it. The challenging thing is that there's many 40 to 50 tests out there right now, and we're trying to sort through which ones are FDA certified. It's important that we get the right test for our people. And my plan there is that once we get the right test, we can identify people who have immunity, and those people can be the ones that make patient contact while the rest of the crew stands back and await what's the determination, are we transporting or not. More to come on that. Telemedicine, we've been very active here. We launched that pilot program 8 days ago. Yesterday I spent a few hours with the advanced providers. Those are the doctors, physician assistants, and nurse practitioners who staff one of the consoles at our dispatch center. We're finding there's about a 50% no-send rate right now. Now let me explain that. When a low-level EMS call comes in and they meet our criteria, the call taker takes that phone call and transfers it to the doctor, physician assistant, or nurse practitioner. Then they establish a FaceTime-like contact with the caller so they can visually see the caller. And then they ask questions and they go over their medical history, and then they make the determination what has to happen. Sometimes it's as easy as phoning in a prescription. Sometimes we send an advanced provider unit or a fast response vehicle. And sometimes we tell them it's not serious, you can go to a clinic tomorrow, or you may not have to go to the hospital at all. So it is being very effective. It enhances patient care, reduces emergency responses, reduces the number of firefighters who are exposed to the coronavirus, and potentially hospital staff if we transport. So by all accounts, it's very successful so far, and we anticipate that it'll continue to evolve. The last thing I want to discuss are our plans for Fire Service Day, which is Saturday, May 9th. This is a big day for us every year. Over the past few years, it's been growing in terms of crowd sizes at multiple fire stations. So we're coming up with something special, a virtual Fire Service Day experience. Our plans now include using one of our helicopters to take a tour of our city and to visit various sites, from the boats in the harbor to the apparatus at LAX to Drill Tower 81, possibly to Fire Station 88. We're still formulating our plan there, but I guarantee you that it will be very interesting. You'll learn a lot, and I think it'll be a good substitute for this year because we can't do our normal demonstrations because of the coronavirus restrictions. So I'll end on that note. I will say that I'm extremely proud of the men and women of the Los Angeles City Fire Department, and we're going to get through this together. Take care.